Welcome back to Mornings. We all know it's very important for couples to share life experiences together, but some might consider my next guests are taking it to the extreme. Couple Christine Longman and Ian Scott will undergo cosmetic surgery together. Good morning, Ian. Hi, Christine. And they're joined this morning by their doctors, plastic surgeons Dr. Michael Zachariah and Dr. George Marcells. How are you, gentlemen?
Very well, thanks.
Well, I got to say, I'm loving this story. This is fantastic. Okay, the two of you are going to do the plastic surgery together. Whose idea was it?
Well, I think it was really mine. Yes, mine, and I influenced him, I'm afraid, yes.
Because, you know, I mean, plastic surgery these days, cosmetic procedures, it's almost becoming commonplace. What, did you sit there on the couch and go, oh, you've got this and da-da-da? How did it work?
Well, it's one of those gradual things as you get older. You look in the mirror every morning and everything's going south and gravity's taking its toll. And what I didn't like, though, is that I felt that I was starting to look very tired as my eyes were drooping a lot more. I was starting to look tired. And also sometimes over the last couple of years I've noticed comments that people have made. I'll be feeling perfectly fine and happy and people will say, oh, is there something wrong, or are you worried about something? So that's when I decided to perhaps look at seeing what I could get done.
And your partner, Ian, tell me when you decided that, okay, this is what I'm going to do.
Well, I had some work recently done on my teeth, and it made a dramatic difference. And I've got chins that are genetic and also weight loss and gain, and so I thought if I can make that much of a difference with my teeth, then I'd go for the face as well.
Fantastic. So the two of you discussed it and you thought, well, why don't we do it together?
Yes.
So we can help each other.
Yeah.
Recover.
Eminently sensible. Because a lot more guys, doctors, and this is your profession, a lot more men are entering into cosmetic procedures, aren't they, Michael?
Absolutely. We probably over the last 5 years I've seen my numbers go from maybe 20% men to about 30 or 40%. And having all sorts of procedures. A lot of them are having nose surgery, some of them the eyes, some of them, of course, like Ian, the neck.
Okay, let's get into exactly what, for a start, why don't we start with, because there's a couple of different procedures both of you are going to have. Christine, who would like to talk about Michael? What will Christine have?
Okay, when we looked at Christine, first of all, skincare I think is very important. So we're going to work on the skin and make sure that that's nicely buffed up.
How do you do that?
Well, various skincare treatments, some light peels, a good skincare regime is important. We also look at the internal aspect of ageing, and so we do anti-aging programs, etc., looking at hormones, etc. Then on the outside, Christine originally came asking about her eyes, but we thought, well, there are some aspects that we could also change that would make
So she'll have her eyes done, what, the top eyes?
We're going to do lift out the brow slightly, we're going to do the upper eyelids, we're going to do the lower eyelids as well, and then just a little bit of lifting here, a little bit of work on the neck as well.
Under the neck and a little on the chin. Now, you do these computer graphics, so just on the left, obviously, before and afters. Just again, point out what we're going to see.
Well, what we can see here, I think the important thing about computer imaging is that this is a guide, and we really have to make it conservative to a degree, but show the patient what we can possibly do. And here we've shown some improvement in the brow, the upper eyelids, the neck. You can see on the side profile there an improvement in the neck, and just what we call the mid-face, the area just behind the nose that you can see there, that's been lifted, and the jowls as well.
Well, as we age, that drops, let's face it.
Unfortunately, it does.
Bummer. I mean, it does, you know, it's part of life. Christine, you saw that after computer generated. How did you feel?
Oh, I'm very excited about it, actually, yes. I think one of the worst aspects is the fact that I feel that I look very tired all the time when I feel fantastic. And so I'd quite like to look the way I feel, and I think that'll be very good.
Okay, now George, let's talk about Ian. What is Ian having? Let's just go through the list first and then we'll be specific.
With Ian, he's having some minor surgery on the upper eyelids just to take away a little bit of the hooding there. But Ian's big concern has been his neck, and it's even something that's been hereditary for him. His father had loose skin around the neck, and he's had it from a young man. And when I assessed Ian, we always assess things in 3 layers. So we look at the bony contours, such as the chin, and the jawline, and underneath Ian's chin and jawline are actually very strong. So the big aim is to lift this loose skin and muscle in the neck. The way we do this is with a face and neck lift, and the important thing here I think is so to avoid a pulled or artificial look, which people are always scared about with the surgery, we go and lift on the deep layer called platysma, which is a muscle layer in the neck. If we can get the tension up in that, I think we can restore that for him.
So the neck lift does actually work. So how do you do that again to get rid of...
Well, we'll make a small incision under the chin here, and we can go in underneath, remove a little bit of fat and tighten up the muscles directly with some stitches. And then we use a facelift incision, which we disguise around the ears here and in the hairline. And we go underneath that thick layer called the platysma, and we lift that platysma and reattach it at a higher level. Then we trim off all the loose skin.
Okay.
Now we should be able to do that in a very natural, look.
Okay.
One other thing that Ian's having, is he's got a mole on his cheek, which he's had for many years. That's a very simple thing to get rid of. We'll just do a little shave excision of that, and he'll have a little crusty sore there for about a week, and then a red spot for several weeks. We'll send that to the lab. If it proves to be anything more serious, we can always go back and re-excise it properly.
Fantastic. Does it scare you a bit, Ian?
A little bit, yeah. Mainly because it's surgery and then hold up for a couple of weeks.
So you're doing this a week apart?
Yes, yes.
Who's going first?
Me.
Whoa!
Tomorrow.
1 minute.
Well, we decided to do it a week apart so that one can look after the other while they're recovering, and then as the first one's recovered, Ian will be able to look after Christine.
So he's going first and then I'm next week.
Fantastic. Okay, the brow lift. How do you do the brow lift, Michael?
The brow lift, we make some small incisions up in the hairline and an incision on the
And
four little incisions.
what does that do? What does a brow lift do?
It really repositions the eyebrows into a higher position and just opens up the eyes in a natural form.
Okay. Let's do a couple of tips, because I know you've been kind enough to if people are interested, some of the things the questions you have to ask if you're going to undergo any cosmetic procedure. What's your advice?
Look, I think first of all the patient has to ask about the experience of the surgeon and make sure that they are qualified. George and myself are both ear, nose and throat surgeons originally, and we specialise in facial plastic surgery.
So all our training is in the head and neck, and we know all that anatomy intimately.
And then I think...
You're going to have a facelift. It's good not to go to a bum doctor.
True. Our clinic is called About Face, so you can take that either way.
Yeah.
And then I think it's important that the patient actually sees some before and after photos, speaks to some of the patients that have actually had surgery, and most importantly has confidence in the surgeon and is able to communicate with the surgeon so that we know what they're talking about and they know what we can achieve.
Make sure you've got a good rapport with the patient and the doctor.
Well, great advice. You start next week, Ian. Chookers to you, and the following week. Now, you'll be joining us when the procedure, when the healing's done. When approximately will that be, doctors?
Well, I think they'll both be socially acceptable to get out and about after about 2 weeks.
I think they're actually quite socially acceptable now, really.
So I meant from our interference with them.
In how long, I'm sorry?
After 2 weeks they'll be okay to get out and about, but there's always a little bit of residual swelling and the wounds to heal a bit longer. So I think we'd be looking at coming back in sort of 4 to 6 weeks after.
Love that. Well, we look forward to that. Doctors, Zachariah and Marcells, thank you very much. Ian and Christine, chookers to you, and it's great to have you with us this morning. I look forward to seeing you.
Thanks very much.
Looking fresh and alive as you feel inside. That's the key. He's worried, I can tell.
We'll look after them.
I'm sure. We've got more coming up on the program. Here's an idea first, though.
What if there was a way to get radiant